Welcome to this introductory informational video on cardiac catheterization. My name is Carl Fitzpatrick.
And my name is Ben Johnson. This project was created for Clemson University's ME 4930 Cardiovascular Biomechanics with Dr. Ethan Kung in the spring of 2017.
Catheters are commonly perceived as devices used for urinary procedures. Here's a cartoon where the nurse finds out that she has accidentally inserted a water hose to the dismay of the patient. Although urinary catheters may seem intimidating, like they're the size of hose pipes, when you're on the receiving end of one, catheters in general are fairly small and safe. Catheter diameters range from 1 to 11 millimeters, which is certainly dwarfed by any water hose.
We'll start with a brief introduction to catheterization, addressing the functions, types, and history of catheters and catheterization. So what is catheterization? The medical definition of catheterization is the passage of a tubular, flexible instrument into a body channel or cavity. Catheters are used very frequently for a wide variety of medical applications. Functionally, catheters allow drainage, fluid or gas administration, surgical access, and more. The figure to the right displays the most common catheter placement for cardiac catheterization.
How are catheters used? The most common uses are for uretic drainage, heart diagnosis, medicine, and measurements. The figure to the right displays the results of a coronary angiography, which is the most frequent procedure in cardiac catheterization. We will discuss coronary angiography more later in this video.
What are the different catheters? Types of catheters include straight, balloon, hydrophilic, and closed system catheters. Cardiac procedures normally use straight and balloon-style catheters. An example of a balloon-style catheter is shown in the image to the right. Urinary procedures normally utilize straight, hydrophilic, and closed system catheters. The straight catheter is the most commonly chosen catheter for general medical uses, such as drainage or medicinal administration. Catheters are generally made from either rubber, plastic, silicone, or latex because these materials have flexible and impermeable characteristics.
The history of catheterization is marked with interesting innovators and compelling stories. Catheterization is considered one of civilization's first therapeutic interventions, with urinary catheters having the longest history, dating back to the ancient Chinese using onion stalks. In 1752, America's founding father, Benjamin Franklin, invented the silver coil uretic catheter to relieve his brother. Cardiac catheterization has a shorter but controversial history. German physician Werner Forssmann is credited with inventing the procedure of cardiac catheterization in humans. He hypothesized that catheters could be used to deliver drugs, inject radiopaque dyes, and take cardiac measurements. In 1929, he used a local anesthetic and inserted a catheter into a vein in his own arm. Forssmann had convinced a nurse to assist him, but she insisted that he do the catheterization on her instead. Forssmann tricked the nurse into being restrained on the operating table and did the procedure on himself. He then walked up 2 flights of stairs to prove the catheterization by X-ray. He was later fired for this procedure, which was explicitly forbidden by the department chief. Forssmann later became a Nazi medical officer in 1932 and rose to the rank of major by 1945. He shared the 1956 Nobel Peace Prize for Medicine for his own cardiac innovation from 1929. In 1958, Mason Sones was credited with inventing selective coronary angiography. However, the method to his discovery was accidental. During a routine catheterization procedure, Sones accidentally injected dye into his patient as the catheter slipped from the aorta into the right coronary artery. In that moment, he saw the coronary arteries in action for the first time. However, this mistake was thought to be fatal, and Sones rushed for his scalpel to begin emergency open heart surgery as the heart began asystole or flatlining. He quickly remembered that a hearty cough could restart the heart. He instructed the patient, whose consciousness was fading, to cough, which saved his life. He realized that a small amount of dye could be used to safely image the coronary arteries. Sones' invention of coronary angiography allowed doctors to see diseased blood vessels for the first time, which began a revolution in modern cardiology.
The remainder of this video will be spent addressing information surrounding common cardiac catheterization procedures. Cardiac catheterization is one of the most common and safe surgical procedures, with over 1 million procedures performed annually in the United States. The mortality rate for cardiac catheterization is less than half of 1% of patients, with most of these deaths occurring due to underlying conditions and cardiac disease. In fact, prior studies have demonstrated an inverse relationship between the annual number of cardiac catheterization procedures and the rate of cardiac complications.
Under what situations may a cardiac catheterization procedure be needed? Catheterization may be used in chest pain diagnoses, follow-ups for an EKG or other tests that suggest heart disease, heart defect examination, pre-heart surgery, or heart muscle sampling to check for heart infection or tumors. Before undergoing a cardiac procedure, patients should know the conditions in which the procedures are performed. These procedures are performed in special catheterization laboratories, which are hospital rooms equipped with diagnostic imaging machines used to visualize and treat abnormalities in the vascular system. The procedure is a minimally invasive surgery, only requiring a small, single opening where the catheter will be inserted. The patient is given local anesthetic to numb the area where the catheter will be inserted, but the patient will remain fully conscious during the procedure.
The following video visualizes cardiac catheterization, utilizing the femoral artery as the means of transportation. First, a guide wire is inserted into the femoral artery. A sheath is threaded over the flexible guide wire, and then the catheter will be navigated and positioned into the desired chamber of the heart. Lastly, the guide wire is removed and the catheter is positioned to perform the desired cardiac procedure.
Risks for cardiac catheterization procedures include bruising, bleeding, or infection, heart attack or stroke, vessel damage, heart rate arrhythmia, which is an irregular heartbeat problem that typically self-resolves, or kidney damage from the injected dye. This complication is more common and highly dangerous in patients with kidney disease because of the risk of kidney damage or failure. Some other cardiac catheter procedures utilize a contrast dye to allow easy imaging with an X-ray machine. Left heart ventriculography is one example which uses contrast dye in the left ventricle to measure things like ejection fraction, stroke volume, and cardiac output. Right heart ventriculography is inserted into the right side of the heart to measure cardiac index, pulmonary pressures, such as the systolic, mean, and diastolic pressures, and the right atrial pressure. As seen here, right heart ventriculography is performed by inserting dye into the right ventricle and taking measurements as it pushes the contrast through the pulmonary system. As mentioned earlier, right heart ventriculography measures cardiac index, pulmonary, systolic, diastolic, and mean pressure, as well as right atrial pressure. If abnormal results are found during testing, some of the possible causes include abnormal connections between the right and left side of the heart, abnormalities of the valves on the right side of the heart, or even atrial myxoma, which is a non-cancerous tumor in the upper left or right side of the heart. A recent technological advancement in the field of cardiac catheterization is a procedure called transcatheter aortic valve replacement, or TAVR. This procedure wasn't used in many hospitals in the United States until 2012, and even now there is still much research being done on it. This valve replacement procedure is performed very similar to the ventriculography procedures mentioned earlier, but instead of injecting dye, this procedure inserts a mechanical valve inside of the malfunctioning valve. Because of this new procedure, valve replacement can be done without open heart surgery, which drastically reduces recovery time and the chance of complications. The future of catheterization is quickly becoming a reality. One such future deals with robotic procedures. One of the biggest concerns in the cath lab has been radiation exposure for cardiologists. The remotely guided robotic systems removes the cardiologist away from the radiation source, as well as allow doctors to get increased control
throughout the procedure that would be impossible to do by other means.